लाइव भी रहता है ना, तो
ओके मैम, ओके, आई हैड नो आइडिया।
यस यस। सो नमस्कार, गुड आफ्टरनून एवरीवन। आज के इस पीवी तिवारी लेक्चर सीरीज के इस सत्र में आप सभी का स्वागत है। हमारे साथ है विद्या मीनाक्षी पांडे मैडम, जो कि असिस्टेंट प्रोफेसर है पीटीएसआर डिपार्टमेंट AIIA न्यू दिल्ली में। तो आप सभी का इस सत्र में स्वागत है। जैसे कि पिछले कई महीनों से हम लोग इस पीवी तिवारी लेक्चर सीरीज को यहाँ पर आप सभी के सामने प्रस्तुत कर रहे हैं, तो आप सभी का इस सत्र में बहुत बहुत स्वागत है। सबसे पहले भगवान धन्वंतरी की वंदना से हम इस सत्र का आरंभ करते हैं।
Shall I share, ma'am?
शंखं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनम् मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम्।
तो स्वागत है मैडम आपका। और आज का हमारा टॉपिक है कष्टार्थ। आई थिंक कष्टार्थ इट इज रियली अ बर्निंग इशू अमंग द toddlers also and young girls and many of like menopause में भी ये बहुत बड़ा एक प्रॉब्लम बन चुका है। तो जैसे कि पिछले कई सत्रों से हम लोग इस सीरीज को चला रहे, काफी सारे स्पीकर्स आ चुके हैं और पीवी तिवारी मैडम के स्मृति के उपलक्ष्य में हमने इसका आयोजन किया है। तो ये निश्चित रूप से हमारे लिए भी सौभाग्य की बात है कि मैडम ने जिस प्रकार से अपना जीवन आयुर्वेद के क्षेत्र में व्यतीत किया है, और खासकर जब भी स्त्री रोगों की बात चलती है तो उनके बिना तो स्त्री रोग का फील्ड अधूरा ही रह जाएगा बिल्कुल। तो इतना बड़ा व्यक्तित्व उनका था। तो मैम स्वागत है आपका। यस,
थैंक यू मैम, थैंक यू सो मच।
आपकी आवाज लो है, वॉल्यूम
ओके,
आपका थोड़ा सा बढ़ा दीजिए।
अभी ठीक है मैम?
यस 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 यस, ओके, यस।
शेयर करूँ मैम, शेयर करूँ?
यस यस, प्लीज प्लीज।
होस्ट डिसेबल पार्टिसिपेंट स्क्रीन शेयरिंग बोल रहा है मैम।
जस्ट अ मिनट, एक मिनट है, मैं आपको ही होस्ट बना देती हूँ।
हाँ,
यस, अभी करिए मैम। अभी करिए। यस यस
मैम विजिबल है सबको?
यस, हाँ आ रहा है, शेयर हो रहा है। यस मैम, यस कंटिन्यू।
नाउ इट इज स्लाइड शो मैम।
हाँ यस यस, या यू कैन कंटिन्यू नाउ। Yes.
A very good afternoon to all. Myself, Dr. Meenakshi Pandey. I'm assistant professor in All India Institute of Ayurveda, New Delhi. At the outset, I would like to remember our beloved great teacher, Professor P.V. Tiwari Madam, because we all know for so many years she has given so many ideas for integrated gynecological practice, and she has molded the Ayurveda gynecology all over India. So I would like to remember her, and also I would like to thank the organizers of Ayush Darpan. To start with, my topic is critical analysis of Kashtartava, that is dysmenorrhea in today's perspective. Friends, the contents would be introduction, landmark, demography, and these subheadings I will discuss the topic. So what is dysmenorrhea? It is a painful cramping sensation in the lower abdomen during menses, often accompanied by other symptoms such as sweating, tachycardia, headache, nausea, vomiting, diarrhea. Although not life-threatening, painful menses can be particularly disruptive to a woman's life and productivity. So in 2020, the International Association of Study of Pain Experts, they reviewed this term, that is pain, and established that pain is an unpleasant sensory and emotional experience associated or similar to that associated with a potential tissue injury. Means if a potential tissue injury occurs, then what sort of pain you can feel, that pain is felt in this particular disease. So the landmarks till now in dysmenorrhea. The history of dysmenorrhea dates back to the Greeks' time, where it was termed as painful menstrual flow. In 1865, first surgical approach, that is bilateral oophorectomy, was done for dysmenorrhea. In 1938, the relationship of dysmenorrhea and ovulation was discovered, and the treatment was done with ovulatory suppression drugs like estrogen. And in 1940, the psychogenic theory, means some psychosomatic or mental, psychological disorder, was also considered as one of the etiology of dysmenorrhea, and many feel that it still remains a part of the etiology of dysmenorrhea. And then in 1978, in a study by Lundstrom and Green, they found that relationship of prostaglandin, there's a strong relationship of prostaglandin to dysmenorrhea. And in a recent article in March 2020, it is said that the relationship of prostaglandin to primary dysmenorrhea is most likely the best explanation a medical science can offer. Means it is the means proven, I can say the most important etiological parameter in primary dysmenorrhea. And nowadays it is said that in secondary dysmenorrhea also the culprit is prostaglandins. So demography says that dysmenorrhea affects 45 to 95% of menstruating women. In an article in 17 June 2021, it is said that dysmenorrhea is the leading morbidity among gynecological disorders and the leading cause of pelvic pain, representing the greatest burden on the menstruating woman. So what is the nirukti of Kashtartava? We all know Kashta is painful, Artava is menstruation. So Kashtena Muchyatiti iti Kashtartava. That is the condition where Artava is shed with great difficulty and pain. But we all know that dysmenorrhea is not mentioned specifically, but terms like Kruchra Artav have come in our classics. So where the terms have come, like Kashtartava as mentioned as a specific symptom in Udavartini Yonivapath. And if you read the features of Udavartini Yonivapath, it's similar, it resembles completely to the primary or spasmodic dysmenorrhea. Then other terms which resemble Kashta Artava, they have correlation with the secondary type of dysmenorrhea. Like we see in Vatala Yoni Vyapath, Shula Nistoda Pidita, that is, and can be correlated with endometriosis and chronic pelvic pain, which is a major cause of secondary dysmenorrhea. Then Paripluta Yoni Vyapath, which is, we consider it as pelvic inflammatory disease. Again, it is a second most important cause in secondary dysmenorrhea. Then Vipluta, Vataj Artav Dushti, hypomenorrhea, or you can say with nutritional deficiency, there is oligomenorrhea, that can be Vataj Artav Dushti. So that is also a cause of secondary dysmenorrhea. And menorrhagia, that's Asrugdar. In that also, Asrugdar maybe we see Ruja word has come. So there also you can take it as a part of Kashtartha. Some diseases, some entities are there where the whole symptomatology denotes like it is Kashtartha, like Pittala Yoni Vyapath, Dahapak Jvaranvita, means it is so severe pain with fever and all. So this can also be this whole symptomatology is like Kashtartha, but direct pain word is not there. Means Ruja या तोद या वेदना ऐसे word direct नहीं है इसमें. Sannipati की Yoni Vyapath, similar to the like whole symptomatologies denotes Kashtartava. Then Suchimukhi Yoni Vyapath, that is pinhole os. And in the modern medical science also, cervical stenosis is considered as one of the major causes of spasmodic dysmenorrhea. So Suchimukhi Yoni Vyapath can also be considered here. And Artavakshay, where it is said that Alpatava Yoni Vedana, means like Artavakshay can also be considered here as part of Kashtartava. The terminologies for Kashtartava in various disorders, these are the terminologies in our granthas. Saruk for Vatiki, Sarshul for Sandipatik, Sarti for Paripluta, Raja Krucha for Udavartini, Saruja for Vata Jasrudhar, Mandarujakar for Kapha Jasrudhar, and so on. The types of dysmenorrhea. According to the modern medical science, the types of dysmenorrhea are primary, which can be considered as spasmodic dysmenorrhea, when there is no identifiable pelvic pathology, and secondary or congestive dysmenorrhea, when the pain is caused by some underlying organic pelvic pathology. So causes of secondary dysmenorrhea, according to this article, is endometriosis, very important, and it is said the most significant cause of secondary dysmenorrhea. Then congenital obstructive Mullerian malformations, like we say that वात दुष्टि है तो फिर there can be मार्ग अवरोध जन्य वात दुष्टि और धातु क्षय जन्य. So this can be a मार्ग अवरोध जन्य वात दुष्टि, congenital obstructive Mullerian malformation है या cervical stenosis. Then ovarian cyst, uterine polyp, uterine fibroid, adenomyosis, PID, pelvic adhesions. These are all causes of secondary dysmenorrhea. So there are some symptoms we all know which differentiates primary and secondary dysmenorrhea. So primary dysmenorrhea, mostly the onset is more than 6 months, but less than 24 months of menarche. But in secondary, the pain starts mostly at an older age, that is more than 25 years of age. In primary dysmenorrhea, pain is starting a few hours or at the time of bleeding. Pain stops before or with conclusion of bleeding. There is midline pain, which can radiate to back or thighs, as patients give history in that way. And one more important thing is that pain characteristics are consistent and predictable from one cycle to the next. So if a patient comes and says that ki पिछली बार भी इस समय ऐसे ही दुखता है, and she knows what is her pain pattern, then she is mostly a case of primary dysmenorrhea. And in secondary cause, the pain will be, you can't define that the pain will be in particular this phase, but it is said that the pain always begins from the luteal phase itself, and the pain may not be only menstrual. The pain may get relieved just after the menses begins, but in different entities of a secondary dysmenorrhea, it is said that the pain can be pan-menstrual, means throughout the menstrual cycle. It could be pre-menstrual, or it could be menstrual pain. So accordingly, if you find the symptoms in patients, you can guess which type of secondary dysmenorrhea she is having. Like if a patient is telling that she's a married woman and she's telling she is having dyspareunia also, dysmenorrhea also, and dyschezia means she is difficulty in passing stool, hematochezia means she is passing blood with stool, and she is already taking treatment for infertility, then she may be a case of endometriosis suffering from secondary cause of dysmenorrhea. And if she complains of acyclic pain or intermenstrual bleeding, she may be a case of adenomyosis. When you find there is a progressive worsening dysmenorrhea on PB, you find there is adnexal tenderness. It could be because of PID. And if abnormal bleeding and pelvic masses are there, then this secondary dysmenorrhea could be because of fibroid, neoplasms, ovarian cyst. So in this way, you have to make the diagnosis. So what is the etiology of dysmenorrhea? According to modern science also, and according to Ayurveda, Manasik Hetu or the psychosomatic factor is given prime importance. So in this an article I read in 2016, it is published, which says that around 51.3% females suffering from dysmenorrhea have depression. And 30.5% who are not suffering from depression, they may have other symptoms like mood swings, lethargy, irritability. So psychosomatic factor has a very important role to play. Then abnormal anatomical and functional aspect of myometrium. It is said that the myometrium and the subendometrial myometrium, the subendometrial myometrium is called as the junctional zone. So sometimes in some patients there is hyperperistalsis or hyperirritability of the junctional zone of the myometrium, and that leads to pain. So that can be a cause of dysmenorrhea. Then in imbalance in the autonomic nervous control of uterine muscles. So in some cases, the sensory nerve fibers of the circular fibers of the uterine muscle, the circular fibers which surround the internal os, they have some means like they have some hypersensitivity, and in such cases, you will see when dilatation is done, this adrenergic nerves are damaged, and it says that she has now relief in pain. So this can be a cause. Then role of prostaglandins. See, whenever there is menses, this is an inflammatory process. So in inflammatory process, arachidonic acid is formed, and that leads to formation of prostaglandins, and prostaglandins help in myometrial contractions. So that may be a cause of dysmenorrhea. Role of vasopressin. It is a new research that vasopressin also leads to dysmenorrhea, but it acts through prostaglandins only, because vasopressin causes release of prostaglandins, and prostaglandin leads to myometrial contractions. Similarly, during inflammation, there will be release of endothelin, platelet activating factor. These also lead to myometrial angina due to severe smooth muscle contractions and leading to pain. So according to Ayurveda, since many of the Univapadas resemble Kashta Artava, we can take same Nidan for the etiology of Kashta Artava also. So Mithyacharen Tahastrinam Pradushta Artavenacha Jayante Bija Dosha Deva Shrunata Putta. So Mithya Ahar would be excessive intake of food which aggravates doshas like Ruksha, Shita, Kharagun. So in today's practice, we can say that the female who eat more of fast foods or chips and different I mean, it's like spicy foods, that can be taken here as Vata Prakopak Ahar. And if she is working and she skips her meal, that is anishan or inadequate intake of food, or she is doing vishamashan because of her office hours, she is not taking her diet properly, so improper diet. So these can lead to Vata Visheshan. Then Mithya Vihar, like in Charak Chikitsa, Charak Chikitsa and 20th chapter, that is Vata Vyadhi Chikitsa. In that, you can see whatever Vihar which leads to vitiation, we can consider here also, like excessive Vyayam. So, in excessive Vyayam would not be the reason, but we can say the females who have more of excessive physical work, she may suffer from Dhatukshayjanya Vata Vriddhi or the other pathology also. Then faulty sexual practices, Ratri Jagran, that is night awakenings, then Diva Swap, then Vegadharan. So these may lead to vitiation of Vata dosha. Pradushta Artha, this can also be correlated as any fault in the reproductive hormones, because modern science also says that some hormonal imbalance is seen in cases of dysmenorrhea patients. Bija dosh, a very good example is Suchimukhi Yoni Vyapat, can be an example of Bija dosh leading to dysmenorrhea. Other one article I read in IASP have done, that is International Association of Study of Pain. This is a genomic study in which they have said that abnormalities in the gene can affect the function of reproductive organs, and they have found an association of chromosome 1p as the culprit in such cases. So if there is familial history, that is mother was suffering from dysmenorrhea and this, then chromosomal study can be assessed. If the severity is so much that you require chromosomal study, then only it should be done. Then Deva, it can be an unknown causative factor. Mansik Hetu, a psychosomatic factor, I said it is very important factor in both the science. So Vata vitiating factors like Chinta, Shok, Bhaya, Krodh, this all lead to psychological stress and thereby may lead to Vata vitiation and pain. Pathology, according to the modern science, it is said that in the secretory phase of the menstrual cycle, there is progesterone withdrawal. This progesterone withdrawal leads to and synthesis of the prostaglandins PGF2 alpha and its release. And this PGF2 alpha and the arachidonic acid, they both help in formation of endothelins, leukotrienes, and platelet activating factors. These all, that is PGF2 alpha and these factors, they cause myometrial contraction in the junctional zone and dysrhythmic contraction, you can say, then leading to reduced blood flow and a feature of myometrial angina. And there is this, due to this ischemia or angina, there is pain. According to Ayurveda, the pathology will be nahi vata dhrute shulam. That is, it is said that disordered vata is the main culprit for pain. So the disordered vata, how it happens? It could be because of marga avrodh, that is obstruction either physiological or anatomical, or dhatukshay, that is the low pain threshold of the patient or lack of the product concerned. So pathogenesis according to Ayurveda will be Nidana Sevan leading to Vata Visheshan, means Vatakar Ahar Bihar Sevan, leading to the Vata gets aggravated, and in two ways, either through the Dhatukshaya Janya Vata Vriddhi or Margavrod Janya Vata Vriddhi, leads to downward flow of the downward flow of menstrual blood is obstructed because due to Dhatukshaya or this Margavrod, there is Drishti of Apana Vayu, and the Apan Vayu, the normal or physiological function of Apan Vayu is disturbed, and it gets localized in the uterus, and the downward flow of menstrual blood is obstructed, and the menstrual blood is discharged with pain, leading to Kashtartha. This pathology will change in the Nidan Sevan. If there is Marga Vrod, the Nidan Sevan could be Kafaj also. Kafaj Ahar Vihar, sorry. Samprapti Ghatak dosh will be Vata dosh. Typically, you can say Vyan and Apan Vayu. Vyan because Akshep, Nimesh, all the contractions and all these functions are of the Vyan Vayu, and Apan Vayu because Artam Nishkraman is Karya of Apan Vayu, and Anubandhit dosh, Pitta and Kaf can be there. So it is a Vata Pradhan Tridosh Vyadhi, Dhatu Ras Rakta Artab, Agni, Jatragni, Rasagni, Raktagni, Srotas Ras Vaha, Rakta Vaha, and Artav Vaha. Srota Dushti can be Sang or can be Vimarga Gaman also. Udbhav Sthan can be Ama Pakvashay, Sthana Sanshray will be Garbhashay, and Vyakti Sthan will be also Garbhashay. Then we come to Margavrod Janya Vata Vriddhi, that is obstruction in the passage. So how this obstruction can be there? It can be anatomical obstruction or physiological obstruction. So anatomical block in passage itself. This could be like in Suchimukhi or cervical stenosis. Anatomical block can be there in the passage of Vata dosha. And sometimes there will be avrutta pathology, like hamper in working capacity of Apan Vayu due to certain things like avrutta vat. Example, Apan Vayu surrounded by kapha or the obstructed by kapha, leading to pain. Dhatukshay Janya Vata Vriddhi. In this, the Dhatukshay may cause Vata Vriddhi, especially of its Ruksha and Khara characteristics, and these in the muscles and in the this will lead to vitiation of Vat and irregular uterine contractions and leading to pain. And whenever there is Dhatukshay, the woman, since she becomes weak, there will be she will be heen sattva, whereby pain will be felt with the slightest disorder. And in many articles, it is said that the female suffering from dysmenorrhea, if her BMI is low and she means she is a case of Dhatukshay also, then with the slightest pain, she may complain of severe pain. This is studied in many articles, means it is a systematic analysis of 38 articles. In that study, it is written. Then Dhatukshay may also indicate hypoplastic uterus and scantiness of Raja and discharge with pain. So characteristics of pain in dysmenorrhea, following type of Vata Vedana is explained, like Arati, Toda, Bhed. So what could be Arati? It could be meaning is anything wrapped around. In obstruction to Vata dosha, Vata is trying to push the contents of uterus outside, but it is getting obstructed. So these efforts of Apan Vayu in the field of Garbhashay can be responsible for Arati type of Vedana, like we see in Paripluta Yoni Vyapat. And if we see this earthy type of Vedna, it is similar pain is characteristic of pain is mentioned in PID, which we correlate with Paripluta Yoni Vapor. So the cramping type of pain and constantly felt in lower abdomen is said in PID, and that is also similar in Paripluta Yoni Vapor, and that can be correlated with earthy type of Vataj Vedna. Then Tod is to strike or to hit. In case of Vat Prakop, due to physiological obstruction to the way of Apan Vayu, there is quantitative increase and pain arises due to striking or hitting against the boundaries. So this can be Vatala Yoni Vapat, where Shula Nisto the Pidita is mentioned, and Vata Jartav Dushti, there also it is mentioned. In modern science with endometriosis we can compare, because sharp and striking pain is a feature of endometriosis, and in Vatala Tod is mentioned, so both have some resemblance. Bhed, breaking or splitting type of pain. This pain resembles the pain of breaking up of tissues. Vata Prakop arising from Dhatukshay, giving rise to increased Rukshata and Kharta, is responsible for Bhed sort of pain. But exact terminology for Bhed could not be found in Ayurvedic classics for dysmenorrhea. But in modern science, adenomyosis and fibroid, in that it is said that stabbing pain is there or sharp knife-like pain is felt. So it can be a splitting or breaking or dividing pain, which is mentioned as Bhed in Ayurveda. Modern view according to the theories related to cause of pain. One theory says that there is cervical obstruction and difficulty in passage of menstrual blood, so there is pain. So that can be explained by Marga Vrojanya Vata Vritti. Then uterine hypoplasia is mentioned. There you can consider it as Dhatukshay Janya Vata Vritti. Hormonal imbalance. Here you can consider as Vata Vritti arising from the Vatakar Ahar Vihar may produce an imbalance in the doshas which govern the menstruation, explaining hormonal imbalance. And neuromuscular incoordination. This can be explained as Rukshata and Kharta when increased due to Vata Vriddhi, due to Dhatukshay and Vata Vriddhi. This can lead to neuromuscular incoordination leading to pain. So in this way we can correlate neuromuscular incoordination with Ayurveda. But the pain causing agent according to modern science is prostaglandins. And I have seen, this PubMed articles are there, and in this they have said that there was a significant difference in the plasma concentration of the metabolite of PGF2 alpha between the group of women without painful menstruation and with pain. Means they have assessed these serum prostaglandin in the females who have pain and who are without dysmenorrhea, and they could see a significant difference in their values. And also they have demonstrated the same finding in the endometrium in women suffering from pain. So you can see serum prostaglandin or endometrial prostaglandins, if you assess, they will be increased in cases of dysmenorrhea. In the other article, I cannot minimize it. In the other article, that is prostaglandin level of primary dysmenorrhea pain sufferers. This is article of March 2020. It says that when they have compared with moderate and severe dysmenorrhea, they could find that the prostaglandin level in the severe dysmenorrhea patients were more than in the moderate dysmenorrhea patients. So both indicate that prostaglandin is the responsible agent for causing pain. So how prostaglandins work? PGF2 alpha mediates the constriction of arcuate vessels leading to local hypoxia of endometrial tissues. Another task is that PGF2 alpha stimulates smooth muscle to contract, and leading which in turn supports menstrual bleeding. Also prostaglandin may cause increasing the migration of neutrophils and leukocytes into the endometrium and for the inflammatory process. One study measured that PGF2 alpha activity in menstrual fluid of the dysmenoric woman were twice the PGF2 alpha activity in the eumenoric woman. Also, similarly, higher urinary leukotriene level was also found in patients of dysmenorrhea, and leukotrienes is formed with the help of prostaglandins. So, synthesis of prostaglandin. I am going in the just a flow chart is there for synthesis. This is important because prostaglandin is the main reason for dysmenorrhea, and if we all know this pathway, we will be able to counteract with our medicines. So among the mediators generated by inflammatory cells, whenever there is menstruation, there is an inflammatory process, and there will be certain derivatives like phospholipids are formed, and this sorry, the pathway is used. Then this inflammation leads to a release of phospholipids. This, with the help of phospholipase C or phospholipase A2 enzyme, forms the arachidonic acid. They both go to the arachidonic acid may use LOX pathway or the COX pathway, that is lipooxygenase pathway or the cyclooxygenase pathway. With the LOX pathway, it forms hydroperoxy-eicosa tetraenoic acid, which later forms leukotrienes. In the other pathway, that is COX pathway, the arachidonic acid with the help of COX2 gets converted to prostaglandin H2, and with the particular synthesis like PGD synthase leads to PGD2, then PGE2, prostacyclin synthase with PGI2, thromboxane synthase leads to thromboxane A2. In this way, the prostaglandins are formed in an inflammatory process. So clinical presentation of dysmenorrhea, the PMS symptoms normally are headache, abdominal pain, back pain, swollen breast, nausea, and even severe acne. Severe acne could be because in the secretory phase there is increase in the progesterone level, and there can be clogging of oil in the pores, leading to severe acne formation in cases of premenstrual syndrome. What investigations we can do? So according to our Sanhitas, there is no investigations are not mentioned directly. So, but few things are there which we can relate here, like personal history. So personal history, she's telling, and you find that there is Vatakar Ahar Vihar, you can accordingly manage the case. With family history, some chronic disorders, and if dysmenorrhea history is there in the family, I said there is genetic correlation with chromosomes 1p. So we can find out that in family history. For general examination, body weight is very important because this is a study in 2015 entitled as U-shaped relationship between body mass index and dysmenorrhea. It is a longitudinal study which says that whenever there is excess BMI, means the patient is overweight or obese, and when there is low BMI, in both the cases there will be the pain will be of severe intensity, means she will be more, there will be more chances that she will suffer from dysmenorrhea rather than a patient having a normal BMI. So body weight is very important, and we can't say that only obese patients will suffer from dysmenorrhea or only lean patients will suffer from dysmenorrhea. Like in Ayurveda, we say Margavrojanya pathology can be there and Dhatukshayjanya pathology. Acne, if severe grade, you can ask for a history of premenstrual syndrome. Systemic examination, every systemic examination is important. For local examination, if a female is married and if you go, so you have idea that pinhole loss or Suchimukhi finding could be there. So if you examine the cervix, just look for it that there is pinhole loss or not. You can find the inflammatory signs like Paripluta, Pitta, Jyoni Vapor, signs like PID. So if there is adnexa tenderness, if there is flush, means redness seen over the vaginal wall or the cervix, or if there is erosion pathology, so that should be treated or managed accordingly. In cases of investigations, normally primary dysmenorrhea does not require any investigation, but if we see that in the first line of treatment the patient has no relief, then we should always rule out for secondary causes. So in that, CBC ESR for her nutritional status, for the inflammatory inflammatory pathology, ESR would be required. If you examine her through per speculum, and if you find some discharges which are infected, you can go for vaginal swab culture, you can go for pap smear for cytology, you can go for pelvic USG if required. In cases where you suspect severe PID, you can go for pelvic USG. In cases where you suspect severe dysmenorrhea leading to some organic pathology like fibroid, adenomyosis, endometriosis, then MRI would be a better diagnostic feature tool, we can say. And if with all these findings we are unable to diagnose, then the last resort will be diagnostic laparoscopy or hysteroscopy in these cases. What would be the medical management? Modern management have taken in very short. Dysmenorrhea primary dysmenorrhea is managed with non-steroidal anti-inflammatory drugs, ovulation suppression, or with OC pills. Then some nutritional supplements are added, like vitamin B supplement, vitamin E supplements. In secondary dysmenorrhea, the underlying cause is treated. These are the NSAIDs which can be used. Penamide group, propionic acid derivative. But I would like to highlight this. This is COX-2 inhibitor. First generation, second generation COX-2 inhibitors are available. One second. Second generation, in this, it is said that in an article in 2003 that in obs and gynae practice, COX-2 inhibitors are likely to play evolving roles in treating abnormal uterine bleeding, endometriosis, ovarian cancer, and perioperative pain, and thus deserve a wider attention and application. And since in the pathology we saw that COX-2 was the main responsible agent which gets converted to prostaglandins, so if we have some COX-2 specific drugs, it would be better, and we can avoid the other side effects of NSAIDs. So, but these drugs are actually not cost effective. So these are not in use when they're not commonly used in India. Surgical treatment. In modern medicine, surgery is considered only when pain is truly spasmodic and so severe to incapacitate the patient, when medical treatment has failed. So what surgeries are advised? Dilatation of the cervix where there is cervical stenosis suspected. There are two surgeries which is done laparoscopically, presacral neurectomy and laparoscopic uterine nerve ablation. So presacral neurectomy, in this operation, the sensory pathways via T11 to T12 from the uterus is cut down. It is not useful for adnexal pain. So why? Because it is carried by the thoracic nerves T9 to T10. So presacral neurectomy could not be a better solution. But in many articles, it is said that LUNA, that is laparoscopic uterine nerve ablation, and presacral neurectomy, if you compare, presacral neurectomy has better results. So if these also fail, then hysterectomy is done. When intense pain persists, then hysterectomy may be occasionally necessary, but this operation should never be carried out in a young woman. We all know that. This article I am specifying because in the surgical treatment, this is an article which says that, this is article of 2005, which says that, however, both operations, that is the PSN, presacral neurectomy, and LUNA, these both operations only partially interrupt the cervical sensory nerve fibers in the pelvic area, and therefore this type of surgery may not always benefit women with dysmenorrhea. So surgery is also not the final solution according to the modern science in dysmenorrhea. And in the this medical clinical policy bulletin in 2021, they have said that combining uterine nerve ablation or presacral neurectomy with surgical treatment of endometriosis does not further improve overall pain relief. Means normally these two surgeries are done along with endometriotic surgery. So it is found that after these presacral neurectomy, also by cutting the nerve fibers also, the pain is not completely relieved. So there is a good scope of Ayurveda in the management of Kashtartva. This is TENS, transcutaneous electric nerve stimulation. TENS is a machine which is a small battery operated device that has leads connected to the electrodes. These electrodes are attached to the skin where pain is felt. When the machine is switched on, small electrical impulses are delivered to the affected area of the body, and the patient feels a tingling sensation. So what it does, this TENS procedure leads to the the preganglionic fibers are bombarded with the impulses which saturate the nerve cells of the dorsal horn and thereby block the propagation of pain impulse, which we can say as gate control theory. And in another theory, it is said that TENS, that is transcutaneous electric nerve stimulation, causes release of endorphins from these nerve cells, and endorphins leads to relief of pain. So holistic Ayurvedic management of Kashtartava, that is painful menses. So how will you manage through Ayurveda? Management of painful menses, according to our Sanhitas, Nidana Parivarjan is the best treatment, first and best treatment. Sankshiptaha Kriya Yogo Nidana Parivarjanam. So we know that na vatadhrute yonihi narinam sampradushyati shamayitva tam anyasya kuryat doshasya bheshajam. So vata should be treated. What could be the principles of treatment? For Margavrojanya pathology, first could be Nidana Parivarjan, Agni Deepan. Obstructive pathology always occurs with Agni Mandya. We have to give Vatanalomak drugs, Shula Prashman and Rakta Shodhak. So for Nidana Parivarjan, fried foods, fast foods, in today's practice I'm talking about, fried foods, fast foods, French fries, chips, these should be avoided. Patient should be counseled for avoiding cold drinks, sodas, energy drinks. In pulses, chickpea, kidney beans, peas should be avoided, eggplant, ice cream. More of fasting, untimely eating should be avoided. Lifestyle to be avoided are, according to the Charak Chikitsa 28 chapter, sleeping in afternoon, night awakening, sleeping on uncomfortable couch, that is Dukkha Shayya. Then excessive Vyayam, which here you will take as excessive physical work by a female. Then Vega Dharan, suppression of natural urges, fasting, stress, anxiety, fear, excess traveling, faulty sexual practices. This all can be vihar, which should be avoided in Nidana Parivarjan. Agneya Dravya, as pathology of obstruction begins with Agni Mandyata, the management approach should concentrate on treating Agni Mandya at Jatragni and Dhatvagni level. So here treatment could be any of the Agni Deepan drugs can be given. Shunti Guduchi Haritki 1:2:3, 6 gram BD with warm water before food can be given. Trikatu Chun normally, which is available in our OPDs, we prescribe those. So Trikatu Chun can be given. Agni Tundi Vati, Chitrakati Vati can be prescribed to them. Vatanolomak dravyas. So what the drugs which are mentioned in Agni Deepan, that can cause Vatanoloman also. But some procedures like Matravasti can be done with these oils. That is the Dashmul tel, Til tel. These are all mentioned in Yoni Vyapadas. And important thing is that all these oils, clinical studies have been done in all these oils except the Sandhavadi tel. So Dashmul tel, Til tel, Traivrutadi tel, Guduchadi tel, Hingwadi tel, in सब पे clinical study हुई है already मात्रावस्थी पे. So Shula Prashman में we can use Shula Prashman Gand, Pipli, Pipli Mool, Chavya Chitrak, Shrungaver, Marich, Ajmoda, Ajganda, Ajaji, Gandirani iti, Dashemani, Shula Prashmanani Bhanti. All these drugs help in Shula Prashman, so that can be advised as single herb preparation. And many of the drugs like Ajmoda, Chitrak, Shunthi, Rason, they have antiprostaglandin content also in them. So that can be used as antiprostaglandin also, and for Shula Prashman according to Ayurveda. Kalpas which can be used as Shula Prashman, we can give Falagrit, in which it is said that Yoni Shuli Nipiritam, Maharasnadikvat, Param Shul Nivaranam, Kashmaryadi Grit, Yoni Vatvira Vikaragnam, Hingwadi Chun, which is mentioned in Yoni Shula Chikitsa and Sharanga Sahita, Shatabri Tel, Yoni Shulam Chanashyati, Pipalyadi Yog, that can be used, Rasnadi Shirpak also can be used. So these are the Kalpas if the patient is complaining of severe pain and you have this availability, so that can be advised according to the case. Asavarishtas which we can prescribe as Ashoka Risht, Pituvin, Asrugdaram, Asrugdar, Rujamajayat, Kumari Asa, Pakti Shula Nivaranam, Dashmularisht, Vatvyadhim Jayat. But in this case, you have to see the menstrual pattern also of the patient. Accordingly, Ashokarish, Kumarias of Dashmularis, whatever is required should be prescribed. For Rakta Shodhak, Manjishta Chun, there is a study on Manjishta Chun which has given significant results in dysmenorrhea. So that can be used. Other drugs like Sariva, Punarnava can also be tried for Rakta Shodhak. In Sthanik Chikitsa, Snehan and Swedan, Yoni Pichu, Yoni Parishek, Yoni Lep, Uttar Basti, this can be used as Sthanic Chikitsa in dysmenorrhea. For Snehan and Swedan in dysmenorrhea, we know Vata Vriddhi is there, so Rukshata and Kharata is there. So oil preparation, external and internal use means Bahya Snehan or Abhyantar Snehan, both can be done. And always Sneha Purva Prayuktin, Sweden Avjite Anila means after Snehan, we should go for Swedan. So Snehan के लिए oils what we can use is for Bahya Snehan, Shuddha Bala Tel, Bala Gudichadi Tel. We practice all these and we have got very good results. And these are all mentioned in Sahastra Yoga for pain. So Bala Gudichadi Tel, Bala Ashwagandhadi Tel, Pinda Tel, that can be used for Bahya Snehan. For Abhyantar Snehan, Bala Tel can be used. Actually, in the shlok it is said for it can be used for Pan, Abhyanga, Basti for all. So Bala Tel, Shir Bala Tel, Sukumar Ghrit is also said as Pathya in Yoni Vyapad. So that can be used in Sahastra Yoga. Kalyanak, Mahakalyanak Ghrit is advised in for pain. So that can be used. One Shulahar Ghrit reference is there for from Sahastra Yoga. It is a very simple preparation of Apamarga Kashai with Pipli Kalka Siddha Ghrit. So, and no study has been done on this drug. So that can be used for Abhyantar Snehan, and similarly research study can be taken on this. Shatavarayadi Ghrit, Sahastra Yoga reference, Palagrit, Sharanda Sanhita. These all can be used for Pan, that is Abhyantar Snehan. So Snehan of Abhyanga of abdomen, back, thighs, legs, which are the main prone areas of pain during menses. So that can be advised to the patient at home. She can do if she is having hot water bag. Sweden can be done with that. For Sthanik Chikitsa, for third Sthanik Chikitsa will be Yoni Pichu. For Yoni Pichu, among all the Yoni Vapadas, Yoni Pichu is advised, like in Rasnadi Tel, Til Tel, Dhatkyadi Tel, Natadi Tel in Vipluta, Sandhavadi Tel, Guduchyadi Tel in Vataj. So these oil can be used in the form of Pichu in cases of dysmenorrhea, but preferably in secondary dysmenorrhea, they have got very good results. So if there is secondary in dysmenorrhea with pathology, like there is erosion or congestion is seen, and cervicitis is there, then these drugs will act in a very nice way. Yoni Parishek can also be done. Ashtanghrida references there Guduchi Tripla Danti Kvathaischa Parishechanam. Practically we do with Guduchi Tripla and Haridra, and we get very good results. We also do Parishek with Dashmul Kashai, so that also has very good promising results. Yoni Lep is advised in Kashyap Sanhita, but I have no practical experience for this. But Yoni Lep in Sanhita is advised, so I am given this slide. For Uttar Basti, oils used for Yoni Pichu can be similarly used for Uttar Basti. Is a reference of Chakradatta while he is talking about the Guduchadi Tel Uttar Basti in Vataj Yoni Vapat. In that it is said that योनि में जो धारण करना है, that can be योना उत्तर बस्तीना प्रवेशित, means it is saying that wherever there is धारण करने बोला योनि में, there you can use it as उत्तर बस्ती also. So if there is severe dysmenorrhea and it is not relieved by only pichu or matra basti, so directly the culprit is the endometrium. So we can give directly the oil or the treatment in intrauterine. With Uttar Basti. Management of associated symptoms. Many a times oligomenorrhea is seen in cases of dysmenorrhea. So we all know these drugs, single drug preparations like Shatpushpa, Shatavari, Kumari, Til, Lashun can be advised. Compound formulations like Dashmul Kashai, Kumari, Asav, Abhyarisht, Raja Pravartni Vati, Arogya Vardhini Vati. Abhyarisht is also said as Pathya in Yoni Vapat, so that can be advised. Hingwadi Chun can be given. For menorrhagia cases, where there will be Dhatukshay-janya pathology, their patient may complain of menorrhagia. So in that, Raktastambhak kalpas like Lodra Asav, Patrang Asav, Ashoka Risht, Kutajashtak Avleha, Pushyanuk Chun, Matra Basti with Shir Balatel, Yashti Madhu Ghrit. I have done study with, my scholar has done, I have guided her. So she has done with Kutajashta Kavleha and Yashti Madhugrit Matra Basti, and both have given very good results. Yashti Madhugrit Matra Basti has got very promising results in menorrhagia. For acne, there are many preparations in granthas, but practically you can advise simple preparations like fried masoor dal powder with milk to the patients at home. Arjuntvak madhu can be used for application. Manjishta churn madhu can be used. Jatifal chandan can be used. Kumkumadi tel abhyang can be advised according to the case. But if the acne is very severe, she might require shodhan procedure, that is woman. Then comes dhatukshay pathology. Here, when there is dhatukshay, bruhan drugs can be advised, like Shatavari Gud, Shatavari Kalp, Kushman Rasayan, Ashwagandhadi Leha, Draksha Arisht, Bala Arisht. Diet and lifestyle. These are modern articles, but I have specified here because these are PubMed articles, and even the modern medical science say that diet and lifestyle have a very important role to play with dysmenorrhea. This is an article, Nutrition as a Potential Factor of Primary Dysmenorrhea, a systematic review of observational studies. In this, what I was telling about 38 articles, this is that study in which it is said that the increased consumption of fruit and vegetables as the source of vitamin and mineral. When those females in whom it was found that she consumes more of fruits and vegetables and more of fish, milk, dairy products, they have positive association with less menstrual pain. Means if she is having a regular diet, she will have less menstrual pain. This is an gist of 38 articles. And then also there is an article on effect of yoga on the menstrual pain, physical fitness, and quality of young women with primary dysmenorrhea. There is also one article, effect of yoga program on menstrual cramps. It is a single blind randomized controlled clinical trial. This is very important trial because it says that there was significant improvement in menstrual pain, physical fitness, and quality of life in the yoga group more than the control group. Control group where the patients were not taught any physical exercise or yoga. So in this comparison, there was significant results with yoga. Dietary advice. What dietary advice we can give? Whatever pathya we have studied in Yoni Vyapat, that can be advised here. Fish, milk, lashun swaras, meat soup, the mouse ras, yav. Also, practically, we give decoction of Krishna tel, Krishna jirak, Krishna til, sorry, Krishna jirak added with good. So that can be advised to patients. Diet having maximum nutrients per calories. Why? Because we don't want to disturb her BMI. We have to make it she should be healthy. For that, there should be maximum nutrients per calories that can be calculated and set to her. Diet should include more of fruits and green leafy vegetables in diet. Natural herbs like methi dana, flaxseed, cinnamon, they help in regularization of hormones. So in cases of dysmenorrhea, she can be advised to take this in early morning. Food supplements, there's a yoga of Gudadrak in Sahasraya. So Gudadrak yoga with madhu it is given. So this can be advised. Til and good, which normally we all prescribe. That can be advised. Chaturbij laddu can be given. This Chaturbij contains laddu can be prepared, and that can be advised 5 gram empty stomach. Khichdi with hing, means asafoetida powder, that can be advised. Ajwain can be given at bedtime. But where there is the dhatukshayjanya pathology, snigdha, ushna, guru, pichil dravyas like rice, kheer should be advised when diagnosis is dhatukshay. So food supplements according to her pathology can be designed. This is Chaturbij Laddu. I have given one slide to it because we have there was a therapeutic dietetic workshop and in which in our institute, in which the European Academy people came here, and for dysmenorrhea we prepared this Chaturbij Laddu as a dietetic preparation. Methika Chandrashur Kala Ajaji Yavanika Etat Chatushtayam Yuktam Chaturbijam iti Smrutam. What it does, Ajirnam Shulam Admanam, Parshva Shulam Kativatham. So in all this that can be used. So these powder drugs were mixed with good, that is jaggery, and 5 gram laddu was prepared. And after the workshop, we were having this preparation, and we used to give to the dysmenorrhea patients of our OPD, and we got very good results. But the statistical analysis was not done, so I have not specified here. Lifestyle changes. In today's scenario, there is increase in nuclear families. We all know this is a part of stress. because there is nobody to share their difficulties at home. Also, there is increased tendency towards late night parties, smoking, alcohol, lack of exercise, fast food consumption, improper Rajasvala Paricharya followed, sedentary lifestyle leading to vitiation of doshas, disturbed metabolism leading to painful menses. So yogasanas can be advised. Dysmenorrhea is a psychosomatic disorder. So any form of exercise is known to release endorphins, which raises the pain threshold of the patient. One article I found, Prabhu S. et al., effect of yogasanas on menstrual cramp in adult females with primary dysmenorrhea. In 2019, this article is there, in which they have given 80 patients were there, and for two groups were divided, in which one they have given yogasanas, and in the other group static poses of core exercise, means core strengthening exercises were there. So significant difference in all the outcome measures was seen in the yogasana group. P was less than 0.05. So these were the asanas which were described in that article: Bhujangasans, Matsyasan, Vajrasan, Dhanurasan, Apanasan, Shavasana. Practically also with Bhujangasan, Vajrasan and Dhanurasan, we see that there is effect with Shavasana also. So these are the benefits of these asanas. All the asanas help in the increase of blood supply to the pelvic organs. They relax the abdominal muscles. They tone up the reproductive organs. And Shavasana, you can say that whenever we know that whenever one is relaxed, the sympathetic effect of various various organs is diminished. So the smooth muscle tone is also reduced, leading to pain, relief from the dysmenorrhea. So research is in Kashtartava. I could find around 22 articles in Kashtartava, so I'm not going in its detail. I'm just showing the slides. One thing I would like to add is that whenever this, in all the researches, whatever I could find, maybe I would have missed once, I could find that in all this Ayurveda researches, never objective parameter like prostaglandin has been mentioned and has been assessed. And also Pichu treatment is mentioned in all the Yoni Vapadas wherever Kashtartava is as a symptom. But in any of the none of the studies, Yoni Pichu was given as part of the treatment. So I'm going to discuss only two studies which are done by me. One is done by myself and another is done by my student under my guidance. So this is both the studies are on prostaglandins. My study is on the endometrial prostaglandins and her study is on the serum prostaglandin level. So the title of the study is Role of Guduchyadi Vati and Guduchyadi Tel Uttarvasti in Bhataj Yoni Vapat. So wherever there were patients of pan-menstrual pain, menstrual pain or premenstrual pain, I included those patients. The sample size was 30. Group 1 was given orally Vati. Guduchyadi Tel Uttarbasti was given in group 2 and Guduchyadi Vati orally with Tel Uttarbasti was given in, means both was given in the group 3. All the statistical analysis are not mentioned here. The group 3 got excellent results, so just their data is here. And in pain, you can see there is 100% improvement. So we decided to assess prostaglandins, endometrial prostaglandins. As I have already said, that COX-2 helps in the formation of prostaglandin. Either it is PGF2 alpha, either it is E2, or either it is I2, it is thromboxane A2. All are formed with the help of COX-2. COX-2 is induced in the proliferative stage of endometrium, and COX-2 rather than COX-1 is the primary isoenzyme involved in the endometrial productions of prostaglandin. So in the present study, COX-2 antibody was taken to assess the difference in its expression on endometrium of patients of painful menses before and after the treatment. This was the experimental work in which premenstrual endometrial biopsy was taken of the patients before and after 3 months of the treatment. The tissue was processed for hematoxylin and eosin stain. Why we do this stain? Because the glands, the glandular, luminal, epithelium, stroma, all the endometrial features can be easily seen. So plan for these are all the steps I'm not going to talk about, but some important things like endometrial sample. Whenever you take, normally whenever we take a tissue sample, we always put it in formalin. We all know that. But here, whenever you want to see the features properly, the sample should be kept in Buin solution, which is not only formalin. It is a combination of picric acid, acetic acid, and formaldehyde. So I used to keep my endometrial tissue in Buin solution. Later, it was washed in running water, put in cassettes, and run into histokinate. This was all the histopathological process. Tissue was placed in L-shaped container, hot wax was poured, and this tissue block was prepared. Later, this tissue was cut into, finely cut in microtome. This is microtome. Then it was kept in water bath. Albumin-coated slides were prepared and they were incubated. And later, we treated it with hematoxylin and xylene stain. In this way it was done. Then the slides were kept in running water until the red color became blue, and it was then treated with acid, 1% acid HCl for 2 to 5 minutes, where the nuclear takes the blue stain and cytoplasm takes the red stain. So in this way it was done. Then the slides were washed in a microscope and the photos were taken at 200 pixel size. This was the microscope which was used. So now, the acute phase of inflammation is characterized by rapid influx of blood granulocytes. So whenever you will see a patient of dysmenorrhea in her endometrium, you will see this type of feature. This is glandular epithelium. This is the stroma. And you see that red color, all WBCs are seen in this endometrial slide. And after treatment with Guruchadivati, that is the group 1, the inflammatory markers are found reduced in treated patients, as you can see in the figure 2. But the endometrium in both the figures appear clumsy. It is not regular. In the second, the inflammatory markers where Guruchadital Uttarvasti was given, these are the WBCs, which you can see in the pre-slide. And in the post-slide, the WBCs or the neutrophils were reduced. And the pattern of endometrium you can see in comparison to previous slide, it is somewhat regular. Then in the third, when both the treatment was combined, you can see these are the inflammatory markers in the pre-slide, and in the post-slide you can see all the endometrial markers are inflammatory markers are reduced significantly, and also the pattern of endometrium after treatment appears regular, like histology of a normal endometrium. So whenever there is inflammation, you can see these inflammatory markers in dysmenorrhea, but the drug acted on the prostaglandin or not, that is not visible with our histopathological slides. So we decided to go for immunohistochemistry, IHC, in which the expression of COX-2 is assessed. Means like the endometrial slides पे वो COX-2 का expression कितना है, वो और बिफोर और आफ्टर में कितना डिफरेंस आया. सो प्रोसीजर फॉर सिग्नलिंग ऑफ एंडोमेट्रियल प्रोस्टाग्लैंडिन्स वाज डन. दिस इज द टोटल प्रोसीजर. आई एम नॉट गोइंग इन डिटेल. This is phosphate. The slides are washed and kept in phosphate buffer solution. Why it is kept in phosphate buffer? Because this helps in preventing the damage to the cells. So always after one procedure, PBS में उसको डाला जाता है. And then antigen retrieval is done by the slides were placed in plastic coupling jar filled with 10 mm of citrate buffer. So this citrate buffer helped in antigen retrieval. Then the slides are kept at room temperature, washed with PBS 3 times each for 5 minutes. Then the slides were incubated with 0.3% H2O2 to block the endogenous peroxidase, and then horse serum was used to block the non-specific sites, because हमें हमारा सिर्फ COX-2 दिखना है, so non-specific sites जो है उसको हमें block करना है. For that I used horse serum. Then later polyclonal COX-2 antibody was added, and the slides were kept overnight at 4 degrees centigrade. Then the slides were again washed with PBS, then stained with a vector stained universal secondary antibody. And then again the slides were washed and incubated with DAB. This DAB gives color formation, which is color जो आएगा वो that is brown precipitate for COX-2. This was the polyclonal COX-2 antibody which I used. So this is the pre-slide, and see the COX-2 expression you can see. What if in IHC what we do in immunohistochemistry, we use antibody and already there is antigen in the sample, so it will react and a precipitate will be formed, and that expression can be seen. So in this COX-2 was there, COX-2 antibody was added, so these expression of brown precipitate, this is all COX-2 expression. So you can see this is more in the pre-slide, but again it is almost same in the second slide. That means the expression of COX-2 in glandular epithelium is almost same as in figure 1 of same patient after treatment, indicating no treatment at prostaglandin level by Guruchadivati. In the second case where Guruchadital Uttarbasti was given, we can see moderate improvement. The COX-2 you can see here, all over, and here this the other margin is almost free with COX-2, and inner margin can be seen with COX-2. So there is moderate reduction in COX-2 expression after treatment. And in the third group where both treatment was given, the expression of COX-2 in glandular epithelium is significant. See, this was a patient of severe dysmenorrhea, and you can see the COX-2 expression, how severe picture is there, and see the reduction. So the COX-2 in glandular epithelium is significantly reduced in comparison to figure 5 of same patient after treatment. So we can say that Guruchadital, Uttarbasti and Vati, if we take both, there will be very good results in prostaglandin level, reduction in prostaglandins. But I am specifying this study here because we get a result with many drugs, but we don't assess and we don't scientifically validate it with prostaglandins. So that should be done. So for that reason, I'm showing this study. This is the third group where you can see now this orange color is for pain, and no pain means 100% relief in pain in the third group was seen. So we can say that Uttarbasti with Guruchadital and oral administration of Guruchadivati together are better choice in females for treatment of Vata Jyoni Vapor in comparison to only Uttarbasti or only administration of Vati. But we know dysmenorrhea is such a disease, like a patient will not come for Uttarbasti for dysmenorrhea normally. So in that cases, we can give Vati also because symptomatic relief in histopathological slides were seen. So when treatment with Uttarbasti is not feasible due to her job, due to other reasons, Guruchadivati may become a satisfactory choice for medication in Vata Jyoni Vapor. Another study is that comparison of this is the study in which Hingwadi Tel, Yoni Pichu and Hingwadi Churn were used. The sample size is 60 patients, 30 in each group. First group was given Yoni Pichu and second group was given Hingwadi Churn. And result for pain during menses, it was found that 89.4% cases improved in group A, means where only local treatment was given, that is only Yoni Pichu was advised, and where oral treatment was there, where there is 78.8% cases relief. These are her statistical results. In vast scale, significant result in lower abdominal pain, backache in both the groups was seen. But in prostaglandin analysis, serum prostaglandin in cases of Hingwadi Tel is significant before treatment and after treatment. The difference is 4.56, and the result is significant in cases of means like serum prostaglandin from the pre and post. There is improvement, means there is a reduction in the serum prostaglandins after treatment in group A where Yoni Hingwadital Pichu was given, and where Hingwadi Churn was given. There also we got significant results. So the 40.1% relief in group A and 40.72% relief in group B was found in the level of serum prostaglandin I'm talking. Baki clinically relief was 80 above 80% as I've shown in the previous slide. So here we can see serum prostaglandin and endometrial prostaglandins. If we assess with our drugs, we can get good results, and if we scientifically validate it, we can put it in a larger platform and talk about it. So my conclusion for Kashtartha would be Ayurveda views dysmenorrhea as a doshic imbalance. This imbalance can be potentially impacted through balanced living that is characterized by dosh-appropriate diet, herbal supplements, exercise, routine yoga, meditation, as well as nourishing supplements. Now we have to take dysmenorrhea very seriously because the WHO and European Pain Federation and International Association for Study of Pain, they have announced as October 17 as World Pain Day since 2004. And what it says, it aims to sensitize both society as a whole and public and private institutions and bodies about the need to use the necessary resources to promote research and development in pain treatment. So, being a public and public institution, it is our responsibility to add new drugs, and also the drugs which are already mentioned in class 6, we are already practicing just to prove it on a research basis, and then we can promote for pain treatment worldwide. So take home message from my side would be the present challenges are globalization of Ayurveda that needs standardization and quality assurance of the in-use drugs besides developing new formulations. There is a strong need to assess effect of Ayurvedic drugs on prostaglandins and COX-2 for scientific validation. And lastly, holistic care with Ayurveda is the best management in cases of painful menses. This is my view. So, see, you can see this lady. She has got the eyes of innocence, face of an angel, a personality of a dreamer, and a smile that hides more pain than you can ever imagine. So, we should not allow this eyes to means cry. So, with these words, I would like to end my presentation. Thank you, one and all. Thank you so much.
Thank you, ma'am. Thank you very much. आपने पूरे ही पॉइंट्स कवर कर दिए फ्रॉम स्टार्ट टू एंड ऑल you have almost covered all the points. Some questions are there.
Sorry for some time.
No, it's okay. It happens. It's okay. So ma'am, ये एक मतलब मेरी तरफ से भी ये सवाल रहेगा कि like when should we start the treatment? कब start करें?
When should we start?
Menses, 5th day, 6th day, या any specific या during?
Ma'am, it should be always prior menses because we know कि जो pathology है वो luteal phase से start हो गई है.
हाँ.
So it should be always like if you are giving matravasti, it should be 9 days prior menses. Accordingly, you have to calculate. अगर बीच में आ भी जाता है menses, so matravasti is not a contraindication. You can give then also. Just flow ज़्यादा रहने पे थोड़ा सा problem होता है. Otherwise, matravasti can be continued, but it should be always prior menses.
Yeah, and during cycle अगर ज्यादा है like PMS symptoms आजकल बहुत ज्यादा मात्रा में मिल रहे हैं तो उसमें हम लोग कैसे लुक आउट करें? तो अवगाहन या अभ्यंग वगैरह तो कर सकते हैं?
स्नेहन स्वेदन तो करना ही है. परिषेक हम कर सकते हैं, जैसे मैंने बताया था दशमूल का कर सकते हैं. त्रिफला गुड़ुची का बहुत अच्छा इफेक्ट है. दंतिक्वात हम नहीं मिलाते, हमारे यहाँ जो गवर्नमेंट सप्लाई में अवेलेबल होता है वो यूज होता है. सो त्रिफला और गिलोय अवेलेबल रहता है तो हम उसी का करते हैं, तो वो बहुत अच्छा इफेक्ट है. वी एड हरिद्रा टू इट, वो कर सकते हैं. या फिर मैंने जैसे बताया सीवियर पेन में आ रही है, यू कैन गो फॉर मात्रावस्ती विद गंधर्व हस्तादि तेल. गुड़चादी वगैरह नॉर्मली अवेलेबल है तो ठीक है कि गंधर्व हस्तादि अगर रहती है हमारे पास तो हम उससे ही कर देते हैं. दशमूल तेल अगर है तो उससे आप मात्रावस्ती दे दीजिए. मात्रावस्ती का बहुत अच्छा इफेक्ट है पेन.
मात्रावस्ती कितने दें हम लोग? 3 मतलब एक दिन के बाद ऐसे दें या कंटिन्यू?
मैम कंटिन्यूअसली यू कैन गिव 60 ml देते हैं, कंटिन्यूअसली दे सकते हैं.
Yes. How many dose of उत्तरबस्ती of गुड़चादी तेल is recommended, ma'am? डॉक्टर कुसुम जी दास की.
अच्छा, ma'am, we have given 5 ml of Guruchadi tel and it was given every time after her menses for 3 days in consecutive cycles for continuous 3 cycles.
अच्छा, आफ्टर मेंसेस
3 days के लिए आते थे हाँ पेशेंट.
और फिर कंटिन्यूएशन 3 months रहेगा?
हाँ मैम, फिर पूरा तीनों साइकिल सेम पैटर्न में रहेगा. और उसके बाद मैंने 4th साइकिल में उसकी एंडोमेट्रियम एनालिसिस की है बाय हिस्टो मींस एंडोमेट्रियल बायोप्सी इज टेकन प्री मेंस्ट्रुअल.
Ma'am, dysmenorrhea is maybe due to like endometriosis in the young girls. Then what should be done exactly? What will be the line of treatment?
Ma'am, whenever there is endometriosis, you can again treat it as Vataji Vapath. So these drugs, like if she is having infertility issue, so I would suggest endometriosis है और infertility issue है तो गुड़चादी तेल की उत्तरबस्ती दो. अगर ओरल ड्रग्स लाइक मीन्स नॉर्मल एक इंडोमेट्रियोसिस पेशेंट है नॉट वांटिंग इश्यू और ऐसी है तो यू कैन गिव ओरल वातानुलोमक द्रव्य जो हम बोल रहे हैं वो दे सकते हैं, और उसके साथ हम मात्रावस्ती कंबाइन कर सकते हैं। समटाइम्स मैम नस्य हैज आल्सो वेरी गुड इफेक्ट, शतपुष्पा तेल का नस्य दे सकते हैं।
अच्छा,
तो वो भी किया जा सकता है। मतलब नॉर्मली एंडोमेट्रियोसिस के पेशेंट में ऐसा होता है कि या तो वो कंटिन्यूअस अमीनोरिया में है और या इंटरमेंस्ट्रुअल ब्लीडिंग में है, तो उसके हिसाब से आपकी ट्रीटमेंट चेंज होगी मैम। तो अगर वो
yes,
अमीनोरिया में जा रही है या डिलेड साइकिल है तो हमें पता है कि वो पेन और कंजेशन बढ़ रहा है उसका एंडोमेट्रियोसिस में, इन दैट केस हम शतपुष्पा तेल का नस्य देकर प्रतिमर्श मात्रा में भी कर सकते हैं, मर्श मात्रा में, दोनों में स्टडी चल रही है हमारे
ड्यूरिंग
यहाँ।
साइकिल नस दे सकते हैं, ड्यूरिंग
मैम
पेन।
ड्यूरिंग साइकिल नहीं, ये तो जब वो ड्यूरिंग पेन, ड्यूरिंग
अच्छा,
साइकिल नहीं
ओके
देना है। तो जैसे
ओके,
एंडोमेट्रियोसिस की है, पेन के साथ है, डिलेड साइकिल भी है, कंजेशन बढ़ रहा है, पेन बढ़ रहा है, उसका मेंसेस नहीं आ रहा है, इन दैट केसेस एंड आप उसको शतपुष्पा तेल का नस्य देते हैं। मर्श मात्रा की स्टडी कंप्लीट हो गई है, 6 ड्रॉप्स इन ईच नॉस्ट्रल देते थे, उसका बहुत अच्छा इफेक्ट मिला है मैम। बट
अच्छा,
हम अभी एक कंपैरिजन स्टडी कर रहे हैं प्रतिमर्श और मर्श मात्रा का। तो जितनी हाफ
ओके,
स्टडी हुई है उसमें रिजल्ट ऐसा है कि प्रतिमर्श से मर्श इज बेटर।
या
तो 6 ड्रॉप्स देना ज्यादा बेहतर है। और हम ये स्टडी मैम ओलिगोमेनोरिया के केसेस में कर रहे हैं, तो विद इन 7 डेज ऑफ नस्य पेशेंट को मेंसेस आ रहे हैं। जो पेशेंट 35 डेज के
डेफिनेटली,
ऊपर हो गया है और नहीं आ रहा है, तो उसका एचपीआई एक्सिस पे भी काम है, या हम कह सकते हैं कि वो
यस,
प्राण वायु को स्टिमुलेट कर रही है और वो प्राण का कंट्रोल है अपान वायु पे, इसलिए अपान वायु का फंक्शन नॉर्मल हो रहा है और मेंसेस आ रहा है। ये भी एक थिंकिंग हो सकती है, बट शतपुष्पा तेल हैज गॉट वेरी गुड रिजल्ट्स।
यस। मैम सुतिका में अगर कुछ ऐसी कंडीशन हमें मिल जाती है,
कैसी है?
मतलब कुछ पेन रिलेटेड है सुतिका में, लाइक नॉर्मल डिलीवरी के बाद भी कभी कभार हो जाता है ना, थर्ड फोर्थ डे पे क्लॉट्स
यस
एंड पेन
यस
वगैरह
यस
होता
यस।
है, तो
तो मैम नॉर्मली जैसे हम थर्ड डे वगैरह आने पे नॉर्मल लेबर की पेशेंट है तो हम दशमूल कषाय,
दशमूल
पंचकोल
अरिष्ट या
चूर्ण,
प्रताप
हाँ
लंकेश्वर
ये सब
कोई
ऐड हो जाता है तो हमारे
सौभाग्य सुनती
हाँ वो नॉर्मली उसमें काम कर जाता है। बाकी हम स्नेहन, सर्वांग स्वेद वो भी ऐड कर सकते हैं इसके साथ। और अगर बहुत पेन है तो मतलब पैथोलॉजी के हिसाब से मैम, जैसे कई बार वातानुलोमक कुछ देने से रिलीफ होता है, सो फिर
यस,
से बस्ती कुड बी वन रिजॉर्ट कर सकते
या
हैं।
फिर एरेंटेल का अनुलोमन या कोई
हाँ यस
विरेचकटी
मैम।
देने से भी बहुत अच्छा
हाँ अच्छा।
इफेक्ट हो जाता है।
यस
यस
मैम
मैम।
यस।
और एक मैं पूछना चाहूंगी, मेनोपॉज में मतलब कैसे लुक आउट करे, मतलब जैसे कि मेनोपॉज में ड्यूरेशन बढ़ जाता है ना, लाइक कभी 6 मंथ्स में, बाद
पेरीमेनोपॉजल में
में,
आपको कहना है, हाँ।
हाँ पेरीमेनोपॉजल में, तो वहां पर
मैम पेरीमेनोपॉजल में अगर ये पेन अगर पूछ रहे हैं आप, तो पेन के लिए जैसे वातानुलोमन हम सब दे रहे हैं वो ही करेंगे। और
हम्म,
मेंसेस लाने के लिए आई वुड सजेस्ट हमें नहीं करना चाहिए कोशिश। जो भी हम वातानुलोमक द्रव्य दे रहे हैं वो अपने से अगर उसका फिजियोलॉजिकली आना है तो उससे वो एंडोमेट्रियम उतना फॉर्म हुआ है तो फिर शेड होगा, तो उस हिसाब से मतलब शेड हो जाएगा और मेंसेस हो जाएगा। बट इनकेस बहुत डिले है और पेरीमेनोपॉजल मीन्स आजकल क्या हो रहा है मैम कि 40 के पहले ही पेरीमेनोपॉजल में चली जा रही है पेशेंट, मीन्स लाइक
यस
38
यस,
टू 40 है, तो वहां पे यू हैव टू मैनेज। लाइक वहां पे हमें कुछ प्रोजेस्ट्रोजेनिक ड्रग्स जैसे शतावरी है, या फिर आप शीरपाक बना के देना, जैसे शतावरी, बला, यष्टि मधु, इनका शीरपाक दे सकते हैं
हिस्टेरिक
पेशेंट के
पेशेंट्स
लिए।
में भी मिल जाता है मैम, कई बारी ना हिस्टेरिया के पेशेंट्स भी दे प्रिटेंड टू बी ये लाइक दैट कि बहुत ज्यादा पेन हो
पेन
रहा
हो
है।
रहा है, यस मैम, इसी के लिए मैंने वो एक स्टडी शेयर की थी। उसमें मैम ये बताया है कि 51.3% फीमेल डिप्रेशन की रहती है, और वो
यस,
डिप्रेशन के कारण वो स्लाइटेस्ट पेन को बहुत ज्यादा बताती है। तो वो जैसे हमारे में धातुक्षय पैथोलॉजी बोला है वो इसमें एकदम कोरिलेट होती है। सो साइकोलॉजिकल या साइकोसोमैटिक, आजकल ऑलमोस्ट सारे डिजीजेस मैम साइकोसोमैटिक है।
some more questions are there मैम।
अच्छा मैम, ठीक।
शतपुष्पा तेल मस्ट इन ओलिगोमेनोरिया में कब से देना चाहिए, और एक सवाल है, और लाइक इंटरसाइकल ब्लीडिंग में क्या दे सकते हैं?
शतपुष्पा तेल मैम कब देना है इन ओलिगोमेनोरिया ना? Whenever the patient comes to you, means like 35 days क्रॉस हो गया है, पेशेंट का मेंसेस नहीं आया है, 35 डेज के बाद हम कहते हैं ना ओलिगोमेनोरिया के डेफिनेशन में, तो अगर हमारे पास ऐसा पेशेंट है तो हम उसको whenever she comes, normally what we do in our practice, we go for hormonal profile, we see her FSH LH level, whether it is derange or not, and if she is a married woman, always rule out with her urine pregnancy test, और अगर फिर भी डाउट है पेशेंट को तो यू कैन गो फॉर हर सीरम बीटा HCG। ये सब से जब आपने रूल आउट कर लिया कि नहीं शी इज अ रियल केस ऑफ ओलिगोमेनोरिया, तो वहां पे आपको नस्से देना है। जिस दिन पेशेंट आप प्लान करते हो मीन्स लाइक नस्से को, उसी समय से स्टार्ट करना है। जैसे आपने रूल आउट कर ली कि वो प्रेग्नेंट नहीं है या अदर पैथोलॉजीज नहीं है, मतलब मेंसेस नहीं आने के, सो उस समय आप तुरंत उसको स्टार्ट कर सकते हो। तो हम क्या करते हैं कि 7 डेज फिर कंटिन्यूसली नस्से देते हैं, और 7 डेज के अंदर हमारा जो एक्सपीरियंस है विद मर्श मात्रा या 6 ड्रॉप्स जब हम देते हैं, तो वहां पे पेशेंट को 3rd या 4th डे तक मेंसेस आता है। और सबसे इम्पोर्टेंट बात हमने देखी कि FSH LH का लेवल मैम, लाइक इफ इट इज अराउंड 50 और 60 भी FSH लेवल है, तो वो भी फॉल किया है आफ्टर शतपुष्पा, और बहुत मिरेकुलस रिजल्ट, मीन्स लाइक 60 से 20 होना एक तरह से मिरेकल है। तो वो 4th डे के मेंसेस उसके आने के बाद फिर से हम FSH LH रिपीट करते हैं, सो एज टू सी द डिफरेंस इन द वैल्यूज, सो वो भी इफेक्ट हमें मिलता है। पर आपका अगर ऐसा है कि पेशेंट को आपने 7 दिन नस से दिया और फिर भी वो नहीं आया मेंसेस, तो हम 1 वीक का गैप देते हैं, और 1 वीक के गैप के बाद फिर से नस से शुरू करते हैं। और फिर अगर 7 डेज के बाद नस से नहीं आया तो वी कंडेम दिस प्रोसीजर, वी डोंट डू इट अगेन।
शतपुष्पा तेल का ही देते हैं?
हाँ मैम, अभी हमारे पास हम प्रैक्टिकली सिर्फ शतपुष्पा तेल से कर रहे हैं।
अच्छा अच्छा, ओके ओके।
वैसे देने के लिए
इसमें देख सकते हैं ना, शतपुष्पा PCOS में भी अच्छा काम करेगा ना?
यस मैम,
PCOS
यस। ओलिगोमेनोरिया एक फीचर है मैम PCOS का, 3 इंपॉर्टेंट फीचर्स में से एक ओलिगोमेनोरिया है, तो ज्यादातर पेशेंट्स वो ओलिगोमेनोरिया वाले जो होते हैं वो PCOS के ही रहते हैं।
यस यस, डेफिनेटली, वेरी नाइस। और एक मैं बस लास्ट सवाल पूछना चाहूंगी, लाइक पोस्ट कैंसर या कोई ब्रेस्ट कैंसर पेशेंट है तो उसमें भी कई बार बाकी ये तो उसके सारे लक्षण रहते हैं, उसके साथ अगर कोई एक स्टार्टो का लक्षण मिले तो उसमें हम लोग कैसे देखें, या कोई हार्मोन का ट्राइगर या कोई वो बताइए मैम।
मैम ऐसे केसेस में अगर मतलब एक तो कैंसर की पैथोलॉजी अगर है तो कुछ रसायन द्रव्य ऐड करना चाहिए। सो गिलोयगोक्शिरामल की नॉर्मली हमारे यहाँ अवेलेबल होता है जो रसायन चूर्ण, वो हम देते हैं ऐसे पेशेंट्स को। विथ अगर उसको पेन है तो वो सिवियरिटी कितनी है, लेकिन लाइक आपको एग्जामिन करने पे अगर इन्फ्लामेशन दिख रहा है, मतलब उसको कैंसर मान लो सर्वाइकल कैंसर ही था, अभी ट्रीटमेंट हो गया या वो ऑपरेट भी हो गई, पर कुछ ऐसे आपको इन्फ्लामेटरी पैथोलॉजी वजाइना में दिख रही है, तो त्रिफला गुगुल का अच्छा रिजल्ट है मैम, वो यूज कर सकते हैं। कई बार ऐसा होता है सिर्फ एक सिंपल वात अनुलोमक लाइक शंखवटी देने पे पेशेंट को रिलीफ हो जाता है। तो और जब भी मैम कैंसर का पेशेंट है तो थोड़ा सा लॉन्ग टर्म ट्रीटमेंट हमें चलानी पड़ती है, तो हमेशा कुछ एक रसायन हमेशा ऐड रखना है उनके में। और वही वातशामक के लिए अगर आपको ऐसा लगता है कि उनकी कुछ और मॉडर्न ड्रग्स चल रही है और उसके साथ वो कैंसर का पेशेंट ज्यादातर 40+ होगा, तो उसमें कहीं ना कोई ऐसे डिसऑर्डर होते हैं लाइक हाइपरटेंशन है या डायबिटीज है, तो हमारा ओरल ड्रग्स अगर हमें लगता है कि नहीं देना चाहिए यहाँ पे या हम देंगे तो ड्रग ड्रग इंटरेक्शन का डर है, तो वहां पे बस्ती दे देना है। तो मात्रा बस्ती हम कर सकते हैं वेरी इजीली और उनको बहुत रिलीफ होता है मैम उससे।
Okay, ma'am. Very nice. Thank you very much. Any other questions, doctors? I hope this is a very informative session. I request Dr. Baljot, ma'am, for the vote of thanks. Ma'am, आप slide share बंद करेंगे, please?
हाँ मैम, श्योर मैम।
Yeah. So,
good evening, everyone.
नमस्कार 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 मैम बलजोत जी, नमस्कार। आई थिंक सारे हमारे डॉक्टर्स भी यहाँ पर जुड़े हैं। आई थिंक डॉक्टर ईना शर्मा, सीनियर मोस्ट प्रैक्टिशनर मैडम का ही हमने पहला रखा था पीवी लेक्चर सीरीज में। इस
नमस्ते मैम, एक्चुअली आई डिड नॉट सी द पार्टिसिपेंट्स मैम।
यस, ईना शुक्ला मैडम इज आल्सो देयर। ईना शर्मा
मैम, बहुत ही इंफॉर्मेटिव सेशन था और आपने ये एक नया पर्सपेक्टिव दिया है डिस्मेनोरिया के लिए, और इस पे कोई स्टडी भी नहीं हुई है और ये स्टडी बहुत सिग्निफिकेंट है। इस पे हमारे को जो हम आयुर्वेदिक ट्रीटमेंट यूज कर रहे हैं उसको हमारे को एक साइंटिफिक बेसिस के लिए आपने एक दिया है, और हमारे लिए थोड़ा सा और इजी हो जाएगा डिजीज को समझना और उसको ट्रीट करना। तो मैम आई रियली थैंक यू सो मच कि आपने बहुत ही इंफॉर्मेटिव नॉलेज शेयर की है। थैंक यू सो मच।
Thank you so much, ma'am. Thank you for the opportunity given to me. And I'm very blessed to speak on the to give a memorial lecture for she's like God for us, Dr. Premvati Tiwari madam. So this opportunity was because of you all. So thank you so much for that.
यस मैम, थैंक यू वेरी मच।
Thank you,
इस
शिल्पा
प्रकार
ma'am.
से यस यस थैंक यू वेरी मच। तो पीवी तिवारी लेक्चर सीरीज को हम लोग चला रहे काफी दिनों से, और ये एक लंबी चलने वाली है क्योंकि इतने सारे स्टूडेंट्स है। सो इसीलिए तो मैम आपका बहुत बहुत आभार। एक अच्छा कंसेप्ट आपने सामने रखा है, जो कि आप एआई दिल्ली से है, तो काफी सारे रिसर्चेस वहां पर होते रहते हैं। सो थैंक यू ऑल, एंड थैंक यू ऑल द डॉक्टर्स जो भी यहाँ पर उपस्थित हैं, उनका सभी का भी मैं आभार व्यक्त करती हूँ। और जल्दी हम लोग नेक्स्ट वीक मिलेंगे और नए स्पीकर के साथ। यस मैम, थैंक यू वेरी मच।
Thank you, ma'am. Thank you.
नमस्कार सभी को।
Congratulations, Meenakshi.
Oh, thank you, ma'am. Thank you so much.
ईना मैम, अभी वही मैं एक्सपेक्ट कर रही थी
मैम आपको ही सोच रही थी।
Congratulations.
थैंक यू मैम, थैंक यू। आई
Nice,
एम
very
ब्लेस्ड
nice.
मैम, आप हैं इस सेशन में, मैं आई एम ब्लेस्ड।
यस यस मैम, हमेशा रहती है। यस
Elaborated and very nice lecture.
ओके, थैंक यू मैम, थैंक यू सो मच फॉर योर ब्लेसिंग्स मैम।
यस
थैंक यू।
थैंक यू, थैंक यू
Shall we
फॉर
leave?
कमिंग मैम। ईना जी नमस्कार,
हाँ?
थैंक यू।
नमस्कार, नमस्कार, कैसे हैं शिल्पा?
यस चल रहा है मैम, चल रहा है। अभी और स्पीकर्स दीजिए मुझे बहुत ज्यादा।
Okay,
So
okay.
we
You
can
will
run
get
it for as a long
Speaker-
run, long marathon.
speakers बहुत सारे हैं, ऐसा नहीं है. A lot of speakers are there.
Yeah, yeah. Yes. Thank you, ma'am.
ठीक है.
Thank you. So nice.
Okay.
Thank you, ma'am.
Okay. Okay. Bye.
नमस्ते।
Namaste.